and is a disability with protections under the Americans with Disabilities Act, guaranteeing individuals the right to health care regardless of their substance use. These laws are violated every day all over this country. The Substance Abuse and Mental Health Services Administration, or SAMHSA, plays a crucial role in funding these programs that provide these life-saving services. In 2020, SAMHSA funded over 25,000 treatment programs, yet these services are in serious jeopardy by these funding cuts. SAMHSA funding accounts for less than 1% of the federal budget. Hands off SAMHSA, yes. These services don't just help individuals, they strengthen entire communities by reducing overdose and allowing people to recover. Access to treatment is critical. Underfunding only perpetuates the cycle of suffering and loss. Imagine somebody finally reaching out for help, only to be told there's no space for them, no funding for their care. For many, this is a death sentence. And yet, instead of investing in real solutions, we've seen fear-mongering, misinformation, and outright lies. The Trump administration has pushed a false narrative about fentanyl, fueling panic instead of offering policy solutions. We've been told of exaggerated overdose death tolls, that migrants are to blame, and that tougher border policies will end the crisis. None of that is true. What is true is that fentanyl is in our communities because demand exists. And demand exists because we are failing to provide accessible, evidence-based treatment. Tougher border policies do nothing to address the root cause. The lack of affordable treatment and supportive services, that is the root cause. The reality is that substance use disorders don't disappear when we criminalize people or build higher laws. We have decades of the war on drugs to prove that. They disappear when we ensure people have access to health care, housing, harm reduction, and support. We cannot afford to go backward. Every dollar cut from SAMHSA isn't just a budgetary adjustment. It's a life put at risk. So what can we do? We must advocate for full funding of SAMHSA programs. I beg of you to join me in this fight. Let's make sure that no one is left without the support they need to survive and recover. We must remind them that when we invest in people, we save lives. I leave you with a quote from an American pioneer and president, FDR. The test of our progress is not whether we add more to the abundance of those that have much. It is whether we provide enough for those who have too little. Thank you. Hands off. And hands off our treatment services. Thank you.
My name is Beth Ockerbloom. I manage programs at Queen City Harm Reduction. I'm going to do my best to holler into this microphone. I work from a place of long-term recovery from addiction, and I walk hand in hand with the people that I have the privilege of serving. Harm reduction provides dignity and hope to people who use drugs that are otherwise lost in a system of oppression. Somewhere between DARE programs and rehab, there is an entire population who deserve the ability to stay alive and care for their health regardless of drug use. Cuts in funding that were promised by our government jeopardize all that has been accomplished to bring life-saving supplies to people who use drugs, supplies and services to people who use drugs, people engaging in sex work, and so many more marginalized populations. Elected and unelected officials of our presidential cabinet and executive offices somehow have the power to make calls that were never in their purview, with a disdain for science and human rights backing their decisions. And speaking of science, harm reduction programs reduce HIV and hepatitis C infection rates by 50% in people participating, which was data that you would have been able to find through CDC resources. Participants in syringe services are 3 times more likely to stop using drugs than a typical drug user. Whatever our moral convictions and whatever the outcome, data doesn't lie. as I said, people who use drugs actively are still valid and are still worthy of health care, of human services, of resources. And thousands of people needing overdose reversal kits such as Narcan, wound care, and so many life-saving supplies come through our doors every year in this county alone, and the risk of losing the ability to serve the most vulnerable will end lives. Funding cuts mean overdose deaths. Funding cuts mean lost health care for people who need it most. And funding cuts mean that the richest people on earth decide who lives and dies, and we can't let it happen. Thanks for all of you.
Hands off. Harm reduction.
Harm reduction.
Hands off.
Hands off.
Harm reduction.
Harm reduction. Weren't they awesome? And I will tell you something, I hope I don't embarrass you, Dane. When I asked Dane to speak, he was supposed to have his ACL repaired last Monday, and he didn't know if he could be here. That's why he's got a brace on his knee. And on top of the threats of Medicare, Medicaid cuts, all of that, they canceled his surgery because he could only give them $2,000 out of his pocket up front. This is what we're dealing with, even for people who have insurance. So hands off. Our medical care. Damn straight. I'm sorry, I'm the one who said no vulgarity. I apologize. I'm from New York, it just slips out. Our next speaker is a UNCC professor who has lost her grant. She's an associate professor of social work at UNC Charlotte and a founding member of the Violence Prevention Center. She has over 70 publications related to violence prevention, not that that's anything we have to deal with, and has been involved in over $5 million in federal research grants from the National Institutes of Health, Centers for Disease Control and Prevention, and other agencies. Quite a bio, and she's here to tell you how all of that is at risk. Help me in welcoming Dr. Annalise Manneke.
That's right, go Niners. Thank you so much for having me today. I have the distinct displeasure to be standing here with my friend and colleague, Dr. Jessamine Moxie. We are researchers at UNC Charlotte, and on March 20th, we had a $450,000 grant from the National Institutes of Health abruptly terminated. Our NIH grant, which, for the record, underwent the most rigorous peer review process in our country, was focused on improving the healing trajectory for LGBTQ+ survivors of sexual violence. The reason it was terminated is because it no longer effectuated agency priorities. That's AI speak, for it included LGBTQ+ people. And with the flick of the wrist or the click of a 20-year-old's mouse, the project was abruptly canceled. Yes. This cancellation, along with hundreds of other cancellations across the country, will have significant negative impacts in our community. First, it will mean that Charlotte will be less healthy and less safe, as we're not able to address the needs of LGBTQ+ survivors of sexual violence. That's a huge problem because they experience sexual assault at 2 to 3 times the rates of others. Mental health care is a human right. Thank you. This grant will also have impacts for the students at UNC Charlotte. This was a special type of grant that funded both the research but also the training. We know that students who are exposed to research become researchers and innovate the most advanced technologies in the world. The cancellation of that grant has disrupted this pipeline. and our team included many students with marginalized identities. That termination disrupted that and conveyed a strong message to our students that they don't matter, the research doesn't matter, their identities don't matter. The government has betrayed them. Now they live in fear. Will they be able to find jobs? Should they speak out? How are they going to pay their bills? And that gets me to the unfortunate economic impacts of canceling this grant. We know from decades, probably more, that prevention works. It is cheaper to invest in prevention than it is to deal with the consequences later as intervention. So by choosing not to invest in prevention, Elon and Doge have chose the more expensive option, which sounds like the real waste, fraud, and abuse to me. The majority of the money for our grant was going directly to support student, staff, and faculty salary. That money is no longer in our economy. Students are questioning how they're going to pay their bills, how they're going to pay their rent, how they're going to pay their tuition. And research has demonstrated that for every $1 of NIH investment, there is a $2.46 yield on return, which means $1 million of losses to Charlotte. Ours is just one grant. There are over 500 and counting that are being terminated across the country. Which gets me to the scariest part of this all. This is the systematic erasure and dehumanization of LGBTQ+ people. That is a precursor to state-sanctioned violence, to apartheid, to genocide. We know that we are beginning to see the depths of the cruelty of this administration as they sweep up our immigrant brothers and sisters and take them to prison torture camps without due process, and we cannot stand. We cannot accept that as a normal outcome. We cannot let these grant terminations be the first step in that slippery slope of an ugly and violent arc of history. I'm here to tell you today that we cannot let Elon Musk, Doge, and Donald Trump set the scientific research agenda for our country. We will not go back to a time when the research is only conducted on cisgender, heterosexual white men like them. We will not let them tell you what is valuable and valued in America. We believe that LGBTQ+ people exist. We believe they matter. We believe they are worthy to be included in our research. And today, we will stand up, and fight back for science.
Hands off! Our science! Hands off! Our research! Hands off! Our science! Hands off! Our research!
Our research. I'll repeat it for you. That was hands off. The VA. Hands off. The VA. Thank you for that, sir. Thank you for your service, I assume. I'm just going to check once. By any chance, is Reverend Sarah Ellis stuck in traffic or out there somewhere? Because she was our next speaker, and I think she got stuck out there somewhere. And she was going to talk to you about Social Security. You know, our money, not an entitlement. So, since I happen to be 71 years old, and I collect Social Security, thank you, I made it. I'll tell you a little bit about it from my perspective. We have been talking about those people who are most affected, but guess what? every single person here will be affected in some way. You will all hopefully turn 65 and be counting on that money, regardless of what your income is. I am very relieved to be able to say I am a person of means. I am a person of privilege. However, neither my husband or I have a pension. All of our money is in our investments. Guess what happened to that this week? So our Social Security, which I am lucky enough to call my extra money, my play money, may become very necessary very soon. Similarly, because I'm over 65, I get Medicare. I look fine standing here in front of you. I have great secondary insurance. I am what is called catastrophic in Medicare terms, and my healthy medical bills last year, just for medication alone, were $180,000. So if I have to start paying that out of my pocket and I lose my Social Security, even I, a person of means, is going to be in trouble. This affects all of us. So before I introduce our last performer, I'm going to do a real important one. Hands off. Hands off. Our money. Our money. Hands off, I didn't hear you. Our money. Our money. One more time. Hands off. Our money. So we all leave here on a really wonderful note, and after this gentleman sings, Rachel's going to have a couple more remarks for you before you turn around and start marching. Again, I'm a child of the 60s, been protesting, marching, rallying for a long time. Every single rally I've ever been to has included this song. We've handed out lyrics for all of you who don't know it. Please, if your hands are free and not holding a sign, cross your hands in front of you and hold the hands of the people next to you, whether it's your best friend or a stranger. You can put your signs down for a minute. It's okay. This is important. All right, I didn't say you have to talk. Just hold hands. So, if you are ready to join with my new best friend, Julius McAdoo. Take it away, Julius.
The biggest part of this song is we. The biggest part of this song is we. We the people. We shall overcome. We shall overcome. We shall overcome someday. Oh, deep in my heart,
come take a bow, please. Harry, Kelly, Harry and Kelly too, our musicians. Come on out here. Harry, Kelly, where's Kelly? She left. Take a bow. Is that a magnificent voice?
All right, I'm gonna hop over here. All right, it wouldn't be an organizing event if we didn't have calls to action for you, right? All right. First of all, don't forget to visit the table over here or look us up, indivisible.org, indivisiblecharlotte.org, sorry. Get involved with Indivisible. We're gonna be here, we're gonna be busy for as long as it takes. How about that? Second call to action. We want you to call your members of Congress. Call those members. Tell them what you experienced here today. Tell them your stories, because you all have them, or you know people who are impacted. So get out there and make those calls. We have the program with our Indivisible group you can find online. It works through 5 calls. We also add in the state calls, because another call to action is paying attention to what's going on with the Allison Riggs situation. We're not going to let them steal that election. Not at all. There will be more information coming. It will be litigated again. That was not the final court. But keep up on what's happening with that, and there will be more calls to action about that and more guidance coming soon. We are working with partners to get that out as soon as the clear directions are available. One more thing to do. Indivisible Charlotte is hosting a Tillis Town Hall. Yeah. On April 24th. We'd love you all to come to participate in that. We have sent a certified mail letter to Senator Tillis inviting him. We are also inviting all of you to call him and invite him. And if his chair is empty, we will still have our town hall. Thank you for being here today. I've got a bunch of thank yous. Our planning committee, the incredible marshals that have been out here, our sound manager, who none of this would be possible without, because none of you would hear us back there. Can you hear me back there? All right. Our interpreters who have been here today, thank you for coming and providing for the deaf community. And Nourish Up, if you brought foods, we are making sure that those donations get to Nourish Up so we can feed hungry people in the Charlotte area. Food can go, if you have it with you still, there's a place to drop donations in the back. Thank all of you. Thank you for caring enough to show up today, for being an active, engaged citizen, and we're going to take off and do our march. So, the plan is we're going to march out here, turn up Billingsley, and then turn up Randolph Road. We have so many people that law enforcement's decided they're going to close all of Randolph Road. That's right. So thank you, CMPD. You can march as little or as much up that road as you would like. We will have water stationed along the path. So stay hydrated, put your voices on the streets, and if you have time afterwards, stop by the Mint Museum. They have a wonderful exhibit right now called Women of Land and Smoke. It is a photography exhibit by Mexican women who have been photographing indigenous communities from LA to Argentina. So spend some money at the Mint. Take care of our arts. Take care of each other today. We thank you. And we have people with signs ready to go up and a march ready to lead out. All right, signs up. Thank you all for being here. Hands up. Charlotte fights back. All right, we know it's going to be a little logjam getting out of the neighborhood. Everybody be patient. Thank you all. We'll get some music going.